Okay, so it looks like the Facebook live stream is still preparing, but we're going to go ahead and get started. Yes, you will be able to hear my kids and the dog. My wife actually scheduled a webinar at the same time as I did, so we are already juggling how it is we work from home together. So good afternoon, everyone. I'm sure you're all doing the same thing as we figure out this quarantine and the COVID-19 and all of that stuff. So I appreciate you being here for this webinar. We are working on streaming it also on Facebook Live, but I do want to welcome you here to Zoom at this moment. I'm going to first recognize Chelsea Turner, who is on my communications team. She serves as the communications specialist for Capistrano Unified School District, and she is going to give you a brief update about how you can find more information from the school district. Chelsea?
Hi, everyone. Thanks so much for joining us today. If you can do us a favor and just let us know that you can hear us by dropping us a message in the chat, we would appreciate it. I'm Chelsea Turner, Communications Specialist for the district. And in a moment, we'll be joined by our guest speaker, Dr. Afif El-Hasan, physician in charge of the Department of Pediatrics at Kaiser Permanente in San Juan Capistrano. Today's webinar will be recorded for those of you who can't join us live. Registrants will be emailed a link to the webinar, which we will post on our YouTube and across our social media channels. Today we'll be diving into a topic on everyone's mind, coronavirus, also known as COVID-19. We'll share what we know about the virus, preventative measures, resources available, and provide answers to your frequently asked questions. Before we get started, I'd like to take you to our website, capousd.org, where we have a web page dedicated as a resource to families on coronavirus. Give me a moment and I will share my screen. All right. So this is our district website, capousd.org. And if you scroll down here, I'm just at the top of the website. If you scroll down to the right, you'll see here in the sidebar a section on novel coronavirus, COVID-19. Go ahead and click that. And that brings you to our webpage where we have all of our latest updates, everything that we know about the district, anything that you would need to know regarding to what is going on. We also have over here linked frequently asked questions. We have all of our CUSD insider stories linked here that shows what we're doing to prevent the virus and strategies we have for engaging students during school closures. And then down here at the bottom, there are several resources available to you, links to other health agencies, as well as some infographics that can help you with information. We also have linked all of our parent communication that has gone out via email. I highly encourage you to go through and look at these emails and make sure that you are receiving them if you're a parent in our district. And if you aren't, we will send out a link when we email out this webinar with some helpful information that you can follow to make sure that you are signed up for those emails so that you're receiving them. And I also encourage you to visit us on social media. You can find us on Facebook, Twitter, and Instagram at Capo Unified. Our social media accounts are the best way to ensure that you're informed with all the latest news and alerts, as well as visiting CUSDinsider.org, which is our news site. Back to you, Ryan.
Thank you, Chelsea. Before I introduce Dr. El-Hasan, and just so the doctor knows, families are already saying hi to you. So some of them are probably your clients and they're excited to see you here.
Oh, okay.
I did want to say that just a brief update on what we know as far as the school district at this point. The Orange County Healthcare Agency will only contact us if a student or a staff member tests positive for coronavirus. And as of today, we still have not been contacted by them directly. We do reach out to them daily, so it is a two-way communication. And as of today, as of this webinar, we do not have a case of a student or a staff member in Capistrano Unified School District testing positive for the virus. If that occurs, we are closed, so we will not have to close the school directly, but we would be able to go into those schools and actually do some deep cleaning, some very deep cleaning, and make sure that we are disinfecting and getting rid of that virus in our schools. I also want to note that there are constantly guidelines coming out from the state of California, from the president, from federal agencies, from local agencies, from county agencies, and we are constantly monitoring those and doing our work to make sure that we can, number one, evaluate what the guidelines are and how they affect the school district. Even the guideline yesterday from the governor as far as staying in your homes and self-quarantining is for families, but it is not for essential services like the school districts. So we are still planning on distance learning next week. Most of our teachers and staff will be doing the work that we normally do in classrooms and at school campuses at home, but we will have some staff reporting to schools in order to keep the work going for our public school students. So that is the latest from yesterday. And like I said, we will continue to monitor that. We work with the Orange County Healthcare Agency, the California Department of Public Health. We have great contacts in the governor's office, so we'll continue to do that work, monitor it every day, and make sure that we're keeping everybody safe. And so now I want to introduce our special guest speaker, Dr. Afif El-Hasan. He actually is a great partner to the school district. We see him frequently he serves as a principal for a day for us at least once a year. He serves a lot of our families locally in San Juan Capistrano. He's a great partner to us, and when we saw him at the end of February for our Principal for a Day event, the doctor actually volunteered to do this for us, to give a webinar or an update to our families and our community on this virus, and to answer questions. So we are very grateful to have him here today. And doctor, I'm going to ask you now to share your screen. And he has about a 30-minute presentation, and then we will open it up for question and answer. If you look on your Zoom dashboard, you will see at the bottom of the screen a Q&A box, or it could be on the top. It depends on what you're using. Feel free to put your questions in there, and we will go through them and answer as many as we can towards the end of the webinar. So now I will turn it over to Dr. El-Hasan.
All right. Thank you very much for having me today. Can you hear me okay?
Yes.
All right, great. Once again, thank you very much for the nice introduction. All three of my kids actually went through the Capo Unified School District, so I'm a big fan. Did 3 times where I slept overnight on the Pilgrim, and 3 nights where I was over at the Ocean Institute, and also enjoyed working with the kids when my own children were young. I did some heart dissections, and my favorite was also the water rockets that we did for the Future Science and Engineering group. So I have a long history with the school district, and it's a pleasure to be here. I wish it was under better circumstances, but nonetheless, we're going to talk today about COVID-19, and I'm going to give everyone an update. The disclaimer I'm going to give is, as Ryan mentioned, honestly, this is changing by the hour. So as of right now, or I should say as of last night, everything that I'm telling to date is possible, but any of it can change, and I do welcome I saw that you have an excellent website for updates, and certainly the school district is welcome to contact me if they need me to give any further updates or need any assistance. So let's go ahead and get started. And I'm going to talk about the coronavirus itself, some clinical information, some control measures, and just how to cope with this, especially with the kids and in the workplace. So this is a picture of a coronavirus that we would see under an electron microscope, and that actually helps explain why we call it corona. Corona meaning sun, So this does almost look like a starburst in the way it looks. It is a very complicated virus and is actually part of a group of viruses that we actually see quite regularly. So there's a lot of technical information on this slide, but the reason I wanted to include this slide is to emphasize the fact that non-COVID-19, the regular coronavirus, the ones that you're seeing, are the types that you're seeing on the screen right now, are actually very common and make about 10 to 30% of the common colds that I see every year. Our issue is this new one is one that our immune system has never seen before. And that's where the problem lies. And that's why we're having so many problems with it, is because none of us have an immunity and our bodies have never been exposed to it before. It is in the same family and the MERS virus that we've seen in the past, but this one has become far more widespread. Now, this is, I know, a little bit technical, but there are multiple proteins on this virus that make it very difficult to make a vaccine against and to help us with our treatment. But what you see is those outcropped S proteins actually bond. They're like little sticky patches that bond to the cells in the upper and lower respiratory tract. So they're actually designed to get into our bodies and latch on, kind of like a ball of Velcro, unfortunately. This screen, we're actually looking at a timeline for COVID-19 and what we've seen over the last few months. So on December 31st, the World Health Organization was first alerted to this virus when they found these unusual cases in Wuhan, China, with a virus that they had never seen before. The first case outside of China was in Thailand and January 13th. On January 21st was the first documented case in this country. And on March 11th, we have now elevated this to the level of a pandemic with 118,000 cases throughout the world in 114 countries. Are the numbers accurate? No, they're not. There's going to be probably much more than that, but these are the ones that we have tested and confirmed at this point. The transmission of this virus is person to person. It's spread by respiratory droplets. Usually it has to be within close contact, so within 6 feet. And the symptoms appear within 2 to 14 days after the exposure. Most, but not all cases, are 4 to 5 days. And most of the contagious factor, most people are most contagious when they're symptomatic. To emphasize with this, that symptomatic can be just a mild runny nose. Someone who has a mild runny nose and cough can be just as symptomatic as someone with an extremely high fever who's having real respiratory issues. So the degree of the illness in a person does not necessarily correlate to how contagious they are. So we do need to take that into account when we are dealing with this as a public health issue and making sure that everyone is safe. There is a question that has come up about pre-symptomatic spread. Is a person symptomatic before they actually, or I'm sorry, are they contagious before they are actually symptomatic? There might be some ability to spread the disease at that point. We don't have specifics or exact numbers, but most of the ability to spread the illness is when the patient is symptomatic. Another question that has come up is contaminated surfaces and objects. And I've actually looked through a lot of the literature on this because there is some variation, but most of it agrees on a few things. First of all, smooth surfaces and surfaces that are non-porous are more likely to hold the virus and be able to transmit the virus to people than porous surfaces. So stainless steel has actually been shown to possibly hold the virus for up to 2 days. Cardboard can actually do it for a day, but also the type of metal that holds the virus or is on the virus is on the surface of can also determine how long it lives, because copper seems to, for instance, only have the virus only lives for about 3 hours on copper. Nonetheless, it just rule of thumb, if everyone's touching something, you have to consider it a surface that can spread the disease. International travelers are at highest risk of exposure for many reasons, not just because they may be coming from a country where there's a large population of infected individuals, but international travelers are in planes, are in cruise ships, and these are areas where, for instance, in a plane, the air is recirculated. You're literally in a tube full of limited air that everyone is sharing. So it does make for a higher chance of becoming infected, and the cruise ships we all know about. But international travelers are at higher risk, and obviously healthcare workers are at higher risk of exposure as well. This chart that you're seeing on the right-hand side shows how far you have to be before you're at less risk from someone who has the illness. So COVID-19 is actually there toward the bottom. Measles, for instance, has a 12 to 18 foot or meter radius for spreading, because it's an airborne particle. Whooping cough, pertussis, also can be spread fairly long distances, which is one of the reasons we become so concerned about whooping cough in general, and one of the reasons why everyone in 7th grade has to have the vaccine. But you can see that COVID-19 is lower on that chart, and 6 feet seems to be the right distance in order for people to distance themselves and keep each other safe. The clinical findings for COVID-19 do vary. You can have some of these symptoms or all of them. The problem with this is there's no one set of symptoms that seems to be predominant for everyone. Although shortness of breath is more frequent in this illness than in the flu and other viruses. But fever is the most common symptom. 87.9% of patients. Dry cough, 67.7% of patients. Fatigue is very common, 38.1% of patients. Sputum production, so spitting up green mucus, or even yellow clear mucus, 33.4% of coronavirus patients. Shortness of breath, as I mentioned, muscle or joint pain, sore throat, headaches, chills. All of them are symptoms that we can see with COVID-19. And unfortunately, even vomiting and diarrhea can be symptoms as well. So this has made it very problematic for our providers who are in clinic, and I do a fair amount of urgent care. And even though patients do not qualify for testing, you can see that based on the symptoms here, that anyone who has any illness, those symptoms can be indicative of COVID-19. And that's one of the reasons we're so cautious with this, and one of the reasons that the governor has put some of the restrictions in place. About 80% of the patients who get COVID-19 get a mild to moderate illness. About 14% get a severe illness, which would imply hospitalization, and 6% critical, where they might need intensive care or extra supportive care. So the problem with this is this virus can look a lot like a lot of the other viruses that we deal with. Flu, the RSV virus, adenovirus, metapneumovirus, parainfluenza, and rhinovirus, all of which can also cause fever, cough, runny nose, vomiting, diarrhea, and that's what makes it so problematic for us. And one of the reasons we're having such a difficult time with this as well. And by the way, while we're battling COVID-19, these other viruses have not gone away. So I am dealing with infants who get RSV and start wheezing. I am dealing with patients who have flu and need Tamiflu. So we just have one more to add to the list of concerns that we have, but all of these viruses are still present, and we have had a very bad flu season. The age range for fatalities has been emphasized in the media quite a bit. Children, for the most part, are going to be relatively unaffected by the virus. Most of them will get mild, if any, symptoms. But the concern is for the age 50 and above. And you can see that the mortality rate jumps at that point. And 18%, there's an 18% mortality rate for those 80 years old and above. And that's actually one of the reasons that we're asking people to give some distance to their loved ones who are senior citizens for this reason. It's one of the reasons why the nursing homes are areas where we're seeing the virus spring up in more frequently and causing more problems for us. So some quick facts: are not getting infected at the same rate as adults, and they typically don't mount a high fever. None have required an ICU up to date at this point. That being said, I have heard on the internet that there may have been 1 or 2 children who died from COVID virus. That's very possible. But for the most part, children, thank goodness, have been unaffected for the most part. Pregnant women are not at increased risk for worse disease. And this is unlike influenza, which tends to hit pregnant women harder. The cases in Wuhan have declined after travel restrictions were put in place. And elderly patients who are greater than 60 with comorbidities, and I'm going to talk about this on the next slide, are at the highest risk for hospitalization. I'm also going to add to that any patient, any person who has any kind of immunocompromise, so someone who's being treated for lupus with chronic steroids, someone who's being treated for rheumatoid arthritis with some of the injectable medications, those patients are probably at higher risk. We don't have exact numbers for them, but they should also be a group of patients who should separate themselves from large groups to protect themselves. As I had mentioned before, carriers of COVID-19 without any cold symptoms are unlikely, and the majority of cases to date are related more to travel exposure rather than to community spread. I think that may change very soon, but as of right now, that's what we're seeing. The recovery time for a mild infection is less than 2 weeks, and for major infections, it can be 3 to 6 weeks. I am seeing some medical literature that is saying that some of the people who, or I should say up to 30% of people who have had infection with COVID-19 are showing reduced lung function afterwards. But I think it's not fair at this point to be able to determine 100% if that is permanent. Example would be asthmatics. Asthmatics can have an asthma attack and have or be affected by a viral illness and have compromised lungs for months and then go back to their regular baseline lung function after that point. We don't know if that's going to happen with COVID-19, but at this point we are seeing the after effects of reduced lung function in patients, in some of the patients who have recovered. It'll be important to look at those patients a year from now, 2 years from now, to see if that lung function comes back or not. I had mentioned chronic diseases, and it looks like at this point, based on the data that we have from China, that patients with underlying cardiovascular disease were most at risk for fatalities. And this is followed by diabetes, followed by chronic respiratory disease, followed by hypertension, and cancer was the last of those mentioned at 5.6%. There are also some studies to show that smokers and people who vape are also at increased risk, not necessarily of death, but of worse disease based on those habits, and that obviously makes sense as well, and would fall under the chronic respiratory disease. And I do consider people who smoke and vape as having self-induced chronic respiratory disease. Treatment at this time for mild infections, we should have transmission to others, and we monitor the patients for clinical deterioration. Supportive care is given as needed. Oxygen, fluids, and antipyretics like Tylenol. And we watch out for deterioration once again of the disease. As with any other viral illness, any virus can lead to secondary bacterial infections. And that is not any different for COVID-19, and one of the important factors we have to keep an eye on, because a certain number of people will not pass away from the virus itself, but from the secondary effect of a bacterial infection, a pneumonia, a full-on sepsis, which is basically an infection of the whole body. To keep an eye on these patients to make sure they're not having secondary illness. A question is going to come up about antipyretics, about Tylenol and Advil. There was some literature that suggested that taking Advil could predispose to worse disease, but then the World Health Organization reversed their stance on it. Best way to go with this is, if you can get away with taking Tylenol for right now, do that until we figure out what's going on with the other fever and pain reducers. There are some medical trials going on with different antivirals and medications that you can see in the box on the right-hand side. These are just trials at this point, and hopefully we will find something very soon. Everyone's talking about testing, and the full genome, the genetic code for this disease, was actually published back in January, which enabled the development of other tests. And we do have tests available. You're looking right now at the middle box, which shows swabs, nose swabs, throat swabs that we can take on our patients who we suspect of COVID-19. And what we're looking at with these swabs is we're looking for the genes that I actually showed you on, for the proteins that I actually showed you in the first slide on that coronavirus picture. The World Health Organization has a test out that detects the E gene. The CDC has one that detects the N gene. They both seem to work pretty well. And those tests tend to come back within a few days. And we are currently expecting a new test to come out that is 10 times faster, those results coming out in less than 4 hours. But that test has not come back in yet. We're waiting on that, and that will hopefully become available. There is a blood test that we can do to check for antibodies for COVID-19, but that test basically is something that you would do after you've had the disease to see if antibodies present. So this just shows previous infection, but doesn't help you at this point with diagnosis of current infection. And we will probably be using it for surveillance and investigational purposes. And I would actually assume at some point that a lot of us are going to get the blood test and find that we were exposed and just didn't have any symptoms. I think we'll see a fair amount of that. But that will be something that will be done in the future, probably just for research and surveillance purposes. We're waiting on a vaccine, And one of the reasons I wanted to show you the actual pictures is because just because we were able to sequence the genes for that, it doesn't mean we know everything about it. Those proteins that are created from the genes, they fold in different ways. And you could see that the virus itself is actually a complicated structure. And we have to make a vaccine that is able to tell our body how to create antibodies to this complicated structure that our body has never seen before. So at this point, we have to test for those vaccines. I know I've seen on the internet, some companies said they developed a vaccine in 3 hours, and that all sounds great. But the reality is that it does take time. It does take testing to do that. Recombinant vaccines are vaccines made of parts of the virus which are harmless, that we introduce to the body, so we create antibodies to them. Messenger RNA basically allows us our body to create antibodies to the parts of the virus that are building blocks. So it stops the virus from being able to create more virus. And we actually have, it's Kaiser Permanente in Washington at the Health Research Institute in Seattle. They're actually doing phase 1 of a clinical trial for a vaccine with 45 healthy adults age 18 to 55. So they're looking at the safety and the ability to induce an immune response. So that's currently going on. But unfortunately, and there's this came from Dr. Fauci at the top, even if the research goes well, a vaccine won't be available for widespread use for 12 to 18 months. So it's going to be a while, unfortunately. So once again, let's talk about protecting yourself and others. The CDC recommendations: wash your hands often with soap and water for at least 20 seconds. Alcohol-based hand sanitizers are also effective. But the reality is, washing your hands is great. So if you don't have sanitizer, if you can wash your hands, that helps quite a bit. Avoid touching your eyes, nose, or mouth with unwashed hands. Those are all gateways for the virus into the body. Avoid close contact with people who are sick, obviously. Stay home if you're sick, except to get medical care, and keep sick children home from school. And I know school's out. The kid even has little sniffles, that counts as sick. And until proven otherwise, it is illness and not allergies. Cover your nose and mouth when you cough or sneeze, and throw the tissue away and wash your hands, and clean and disinfect objects and surfaces you touch. Be careful with elevator buttons, door handles, and anywhere else where lots of people touch them. Try to use something besides your hand to touch those areas in public if you can. So let's talk about the control measures and the definitions of those measures. So everyone's heard of social distancing, and that basically means we're going to increase the space between people to avoid the spread of this disease. People are working from home, schools are closing, we're canceling conferences and large meetings. The definition of a shelter-in-place order is to stay at home except for essential activities or essential business, and that's something actually, as we've seen now, is being issued during a public health emergency. If sick, then we're dealing with isolation, and that means keep the infected person away from the uninfected, either at home, hospital, or at a care facility. And the definition of a self-quarantine: so if you're exposed to COVID-19, you would be asked to stay at home for 14 days with no visitors, be greater than 6 feet from others in the household, and standard hygiene, frequent hand washing, don't share towels or utensils, and if you can have your own bathroom, that would help as well. Now, A lot of people have heard the term flatten the curve, and this is being talked about a lot. And one of the reasons we're doing all the isolation. Here's our problem. We only have so many ICU beds. We only have so many hospital beds, and we only have so many doctors and healthcare workers. And if everyone gets sick at once, if we can't at least decrease the rate at which everyone is getting sick and coming down with this, then we are going to overwhelm our ability to take care of our patients. And you can see on this graph, the dotted line is the healthcare system capacity. And if we don't take protective measures, we are going to overwhelm our capacity. And then we're going to start seeing the pictures that we're seeing in Italy of people in the halls having difficulty breathing and not enough ventilators and not enough capacity within our system. This is actually very real and is a very serious concern for us. And that's one of the reasons this lockdown, or I should say this isolation, the measures being taken right now are so important, because even if everyone gets the disease, if we can at least slow down how fast it happens, we can hopefully take care of everyone with the resources we have and give everyone the care and attention that they need. And if we don't do the protective measures, we will not be able to do that. And that's going to be a very serious problem for us. Now, I've already gone over these already, but the graph was the most important part of this here. And what we're asking everyone to do, and something to share with our children, is we're trying to take responsibility as a society to make sure that we slow this down. So kids, helping children cope with the coronavirus. A lot of important and very simple things that can be done by our parents. One thing, I know we're all secretly and privately terrified of all of this. We don't need the kids to know our level of fear. We don't need to talk about it constantly. We should avoid leaving the TV on constant pandemic coverage. Yes, we need to be cautious. Our children need to know that there's an illness out there, but the fear and the anxiety that go with that should not be conveyed to kids. Kids sense things, as you know, and they will become very afraid if we become afraid. And while we need them to be aware and cautious, fear is not a good thing. We should emphasize that the children are at home to protect themselves, their friends, and the ones they love. Let's give them a reason and an understanding why they are at home, and not just say you're at home because of a pandemic. Tell them why. Telling children why is always important, and it does help them understand. And it's a good time for learning duties to the family, obligations to society. It's educational too. Another thing, show them how much you enjoy having them at home. Treat it like a treat, a bonding time with kids. It helps them to feel like, yes, they may still be getting remote school, they still are obligated to do their schoolwork, but this isn't a punishment in any way. It's not meant, and the parents should feel like it's a happy thing and convey that to them. If they need to avoid elderly or immunocompromised relatives, emphasize how proud you are that they are protecting those relatives by staying away. But the flip side of that also is, please keep contact with those relatives, have them keep contact, make it one of their chores and duties at home to Skype their relatives, to talk with grandparents and susceptible members every day. Make sure that those elderly and immunocompromised relatives and friends don't feel alone. And it may also be occasionally dropping off food in obviously a way that's not contagious, but making sure that they understand why they can't see their relatives and what's going on with the relatives and the reasons for everything. Also, take advantage of counseling as needed for unfortunate events. Statistically, we all know people over the age of 70 or 80. A lot of them are going to pass away from them. And we're going to either have a relative or friend who passes away or know of a relative or friend who passes away. And our children, even if they don't have a loss in their family, will know someone who does have a loss. So take advantage of counseling services as needed, but also make sure the children feel comfortable talking about their feelings and expressing their feelings about this. Any fears they have, any anxiety, they need to feel free to discuss it. And we are going to, this virus is going to take its toll on the elderly, and people will lose loved ones. And to make it worse, it may be in a very remote manner where a child may not be able to say bye to a relative in a way that they would want to, because they have to keep distance. So children's activities, do's and don'ts. Enjoy open spaces. And actually, I believe the governor at this point still says you can go take a walk. Open spaces, blades of grass, trails, and sidewalks are less likely to spread the disease, and it's a great way to run around and be far away from other people. Spring into the season, we are in springtime, so there are some nice activities that people can do at home or at parks, planting, bird watching. Good time to teach kids how to clean. Good time to have them walk the dog. Very important, keep screen time educational and interactive. Our kids do need to do their work, their schoolwork, but try to make sure that the time they have when they're doing recreational activities on the computer is spent interacting with others, or at least try to keep it educational. I know that's not going to be very easy to do all the time, and we need to forgive some of the screen time during this period with the kids to give them a little bit more than we normally do, but as productive as possible. It's also a good time for them to learn what parents did when they were young, before everyone had an iPad, which is read, do puzzles, board games, scavenger hunts. And it's a good time for life skills. Learn to cook, help with the house. And a big one here is learn good hygiene. The hand washing, not touching your face. These practices that are being done for COVID-19 are going to be good skills to keep and to remember moving forward. Also, keep the food healthy with occasional sweets. I know the easiest thing in the world with little kids is to give them a goodie to tell them to quiet them down. And we need to refrain from that, because if there's less activity, plus they're taking in more calories, it's going to lead to obesity and other problems. And I also say practice musical instruments. Good time to get really good with the musical instruments. Important don'ts. Don't go to public swimming pools. The water itself may be non-contagious, but the handles of the ladders, the concrete that people touch, and the chairs at public swimming pools are all going to harbor the organism, because everyone's going to be touching them. Avoid public playgrounds. Once again, a lot of people are touching smooth surfaces where the virus can live for a very long time. Be very cautious about play dates. Play dates are obviously wonderful, but this is a very dangerous time to have play dates, because the kids, anyone can have a very mild illness and spread it to other people who can get a more serious illness. Avoid contact sports with other children, and obviously avoid movie theaters, restaurants, and amusement parks. Medical basics during this pandemic are golden. please utilize them. I know we have them at Kaiser Permanente, but I know that in the community as well, phone visits for non-critical minor issues is a very good idea. Obviously, if people need to come in, they should, but if we can take care of business over the phone, that would be a good idea. Make sure your child has an ample supply of any needed prescription medication. Utilize mail-in pharmacy services when available if you need prescriptions so that you can stay out of a pharmacy which will probably have a lot of sick people. Have basic medications and first aid supplies readily available. I'm not saying hoard supplies, but I am saying keep the basics around, and you will need them, especially with everyone running around at home. And while avoiding a medical clinic is appropriate for minor illnesses or injuries, please seek face-to-face medical care if there is an emergency. I have had a fair number of phone visits, and I've been doing a lot of them, where I felt very strongly the child needed to come in, and the parents were reluctant to do so because of COVID-19, and I don't blame them, and I understand the fear. But if you are told to come in because the physician feels that your condition is serious enough that a telephone visit won't do it, please do go in. The ERs, the urgent cares, are making sure that things are as sanitary as possible for the patients. And as I had said earlier in the slides, we are seeing other viruses. We are seeing other illness. We are seeing appendicitis and asthma attacks. And those can't be treated remotely. They do need to come in. They do need to be seen so that the children are safe and everyone else. Some quick business recommendations, because some people do still need to go to work. Actively encourage sick employees to stay home, as I had mentioned before. Separate sick employees and send them home immediately. Establish flexible work sites and flexible work hours if possible. Make plans for increased absenteeism and supply chain interruptions. And review your human resources policies. Perform full cleaning. Areas that get touched at work a lot should be cleaned more often. Emphasize respiratory etiquette and hand hygiene. And notify employees of possible workplace exposures, but obviously maintain confidentiality. Cancel non-essential travel. Cancel large meetings and events, obviously, and I hope everyone's doing that at this point. And that's about it from my end. I'd be happy to take some questions.
Thank you, Doctor. That was fantastic. The first one that we're getting is just emphasis through chat that about play dates and not having play dates unless they're virtual, correct?
I feel that's much more appropriate, and it's a great way to use the technology. Skype your friend, have a good teleconference play date. It's a great time to do it.
Okay. And then, can the virus be transmitted through food, or if you're picking up orders to go, what does that look like for people to make sure that it is safe for them to eat?
The food is probably okay. Food itself, and I was anticipating this question. I was actually looking it up on some of the sites. Food itself is porous and it is also hot. I think hot food would be fine. I will say that I would be careful with the container for the food itself. Unwrap it and remove any wrapping promptly, but the food itself should be safe.
Okay, thank you. If I have rhinovirus symptoms but never got a fever, at what point is a COVID-19 test needed or recommended?
So if at this point, per CDC guidelines, someone without a fever who has just a runny nose and cough would probably not be tested unless there was recent international travel, confirmed exposure to someone with COVID-19. So if it's just mild symptoms, at this point, testing would probably not be conducted. That is actually one of the things, though, that can change by the hour. We are hoping at some point soon that we'll have enough tests that we can test everyone who wants a test, but we're not there yet. So if you don't have a fever, don't have shortness of breath, and it's just a runny nose, I would just watch it.
Okay. Is it necessary to sanitize groceries and other things delivered from Amazon or UPS?
Probably not. I think just very mild. I would actually think the inside of the package is probably perfectly fine. I had mentioned that in theory, the coronavirus could live on cardboard for a little while. Just remove the outer covering. Maybe I haven't seen any formal policy on that, but maybe just have a small garbage bag outside the door and remove, unbox it right there at the front door with gloves. Put the cardboard in a bag and bring in what's inside. What's inside is probably okay.
Okay. And then someone heard that it could stay in the air for up to 30 minutes. So can you talk a little bit more and provide some clarity on the rules for social distancing, the idea of being 6 feet away from someone and why that's important?
Droplets, that is correct. It could, but droplets fairly quickly tend to go toward the ground. It's the first few seconds after a cough or a sneeze that are most risky. But droplets adhere, so putting a hand over or a tissue over the mouth actually catches a lot of the actual droplets. So walking through the regular air, you should be fine. And I guess I should comment about masks. At this point, there is no recommendation to walk around with a mask in place. We actually think it may increase transmission of the disease because people who have masks on tend to touch their faces more. That being said, though, if you are ill, putting a mask on does seem to hold in the droplets and the that could have a virus, and not just for coronavirus, but for other viruses as well. So for healthy people, putting on a mask is not a recommendation. And you should be okay as long as you keep your distance a little bit from other people. I do acknowledge the 30 minutes where the virus can be in the air, but really it tends to be more just immediately after a sneeze or a cough that it stays in the air, and it tends to either latch to something or go to the ground.
Okay, thank you, doctor. And then another question, should we expect for COVID-19 to be an issue next flu season and thereafter?
We do expect it to stick around, unfortunately. I think the first wave is going to expose most of us, but we do anticipate seeing it again in the fall after there's a lull. And we are hoping that we will have, within the next 6 months to a year, antivirals and other treatments available to help us with this, including rapid testing for the virus and the vaccine, as I mentioned, 12 to 18 months from now. We're also hoping that by that point, the majority of people will have immunity and it won't be spread as quickly as it is now.
Whoops, am I muted?
Oh, you're muted.
I am. If someone recovers from it, would they develop an immunity towards it?
If you recover from the virus, that means your body successfully fought it off. And yes, you will have antibodies to the virus. Does that mean you're 100% immune? It does not. It is possible, maybe, we don't have data yet, to catch it again in a more minor form. But if you've caught it and fought it off, it means your body has successfully created antibodies to it, and you will be able to benefit from that moving forward. Yes.
Okay. And then should there be extra concern for children diagnosed with asthma?
Yes. A few things. First of all, make sure you have an inhaler. I've actually been looking through the literature on children for multiple scenarios, actually. Even children with asthma seem to do okay with coronavirus as far as we can tell right now. And the fact that China has areas with very bad air pollution with high pediatric asthma rate, those kids still did okay, is, I hope, encouraging for us here. The other question that comes up, and I think some of the people on this call are even some of my asthma patients, and hi to everyone who sent me a message. The other question that comes up is, because any inhaled steroid that we use for asthma does cause, in theory, a mild immunosuppression in the lungs, does that predispose that person, that patient, to a more serious disease? And at this point, we don't think so. We don't have 100% data, but the problem with stopping preventative asthma medications is all of a sudden you've increased the inflammation and secretions within the lungs, and thereby made it harder for you to fight infection from that perspective as well. So I would actually recommend that everyone who is an asthmatic talk to their physician, come up with a plan moving forward, and stay on the medications unless instructed to do otherwise.
Okay, and then we get a lot of questions about people going out either to the grocery store to pick up food from a restaurant, maybe for a bike ride or a walk. Are there any certain precautions they should do when they get home? Should they leave their shoes outside? They need to wash their hands, of course. Should they change their clothes? What else would you recommend?
Good hand washing is key to everything. I think that's probably the most important. If you know, when you go out, if you need to go shopping, I think using the wipes to wipe down the handle and the seat and the shopping cart is an excellent idea. And I don't know if you need to change the clothes when you come home, but if you wear an outer layer of clothing like a jacket when you go out and take that off when you go back in the house, I think that's reasonable. There haven't been any formal recommendations on that yet, especially since, once again, it's more the very smooth surfaces like plastic and metal that actually make it transmit the virus better. Clothes and hair tend to transmit it less so. But if you want to have the outdoor jacket that you take off before you go back inside, I think that's reasonable.
Okay, and then is it safe to make food for at-risk relatives?
I think it is. I think the outer covering on the food is something to be careful about. And you bring up a good point. If package it in such a way that the outer layer can be removed maybe outside before it's taken in by an elderly person. The children, like I said, even if they have a slightly runny nose, are shedding the virus. So I would actually put everything, cook it, put it in a paper bag, and when it's delivered to a relative, have the relative remove the paper bag outside, put it away, leave it outside in the garbage bag, and take what's inside the bag inside. I think that would be a reasonable way to go.
Okay. Checking the time. We are right at 2 o'clock, so we'll take a few more questions. We could probably do this for another 4 hours, Doctor. Let's see.
I'm okay.
If a person is pregnant and they have appointments for ultrasounds and things like that, should they put those off? Should they go into the doctor's office? What is your advice on that?
They should talk to their OB-GYN. I would, this is one of those cases where we have to take it very seriously. Prenatal care is extremely important. And I know that the OB-GYN clinics where they are doing prenatal care are being very careful in how they sterilize the clinic for our pregnant patients. I would not cancel an OB-GYN appointment for that reason unless you were instructed to do so by the obstetrician. I think prenatal care is extremely important. We don't want to have anything bad happen to the babies. And that being said, other well visits. We are, for instance, at our clinic, going to be delaying for 1 month routine well child visits in healthy children because that we can get away with that. It's okay. And it's safer for the children and their parents not to be there. But we have to take a more weighted approach with pregnant members and also other chronically ill members who should get their follow-up from their physicians.
Okay, so children specifically, if they don't have a fever or other symptoms like headaches or dry cough, should you just do home care at home? I have other questions about children with sniffly nose or slight cough. Should they quarantine? Should they stay at home? What does that look like for families?
I think they should stay at home, and because once again, while the vast majority of those are going to be rhinovirus or flu or parainfluenza, some of those are going to be COVID-19, and it's just not going to show itself as a severe illness in most children. So they should stay at home and just follow good hand washing and until they feel better. But yeah, I would keep them at home, definitely.
Okay. A lot of questions about cleaning wipes or other products they should be using for cleaning. If someone's low on Clorox wipes or Lysol, what else would you recommend?
There are some good sites on the internet, and I believe also on the CDC site as well, that talks about solutions you can make either with bleach or vinegar that work very well. So if you look on the CDC site, you will actually be able to find some good information and some good recipes for that.
Okay. Does Lysol work to use in the workspace area?
Lysol, I believe the spray, I know the wipes are one of the approved disinfectants. It does work in those areas. That being said, also be careful of the fumes. Some people do get irritation from them, but they can work, yes.
Okay. I'm just looking through.
And a comment, I believe the CDC has a list of approved wipes and other cleaners that do work against COVID-19, and that can be seen through the CDC site as well.
And then what is considered a fever?
A fever is 100.4 degrees Fahrenheit or above, 100.4.
Okay.
Now, no one keeps a consistent fever. We have what's called fever curves. So people's temperatures will go up and down. Most people will be hottest at night when they are bundled up in a blanket. So having a 100 or a 99.8 temperature during the daytime may actually turn into a higher temperature at night. So just because you take a temperature once doesn't mean that's it and you're done.
All right. And then there's some questions just about distance learning for us next week. There will be some packets and other items sent home for parents, for families and students. What about sharing paper packets back and forth between teachers and students? We'll be giving Chromebooks out to families who need those resources in their home. So what advice would you give for that kind of stuff?
You mean actually handing a computer from one person to another?
Yeah, it would actually be our Chromebooks and other laptops that would be going from the district office or from school sites to homes.
And they would be handed out in the school.
Yeah.
Well, I'm going to assume that the staff who will be handing them out will be asymptomatic. If everyone wants to play it safe, and it may be a little bit overdoing it, but if the person handing them out also wants to wear some gloves and a mask when they hand out the Chromebook pack, that should be fine. If someone wants to, if the student wants to unpackage it there and leave the cardboard there, that's fine as well, and just take the Chromebook that's inside, and that shouldn't be a problem. There shouldn't be any threat in that. That might be overdoing it, but it's something that would probably make a lot of people comfortable.
And then if it's a used Chromebook, we would just recommend, again, when you get it home, to wipe it down and clean it off.
That's reasonable, yeah.
One more. There's a lot of questions about specific diseases, specific things like autoimmune diseases and things like that. Does that put someone at a higher risk?
The autoimmune disease, if it causes a compromise of the immune system, could. Also, the treatment itself for autoimmune diseases, I had mentioned lupus, could cause immunocompromise for the patient, and for some patients it may increase their susceptibility to COVID or could make the symptoms worse. So that's always a possibility, and it should be something that should be discussed with the person's physician. And I'm thinking chronic steroid use would be one, oral steroids would be one, certainly chemotherapy would be another one, as well, and any of the other oral or injectable immunosuppressants. But patients should talk to their doctor about it. But if you do have a medication or an illness that compromises your immune system, a good example, cystic fibrosis, treat that as an immunocompromise and be cautious accordingly.
Okay. And then I think I will end it here. If audience members have specific questions about school and distance learning, I would just ask that you email communications@capousd.org, and we will try to get those out to the correct staff members who can help answer those questions. I know there's a lot of questions about what distance learning would look like next week. Your teachers should be reaching out to you on Monday in order to get all of that prepared to start on Tuesday. Some of you I know have already heard from principals and from your teachers. You can always check our Facebook at Capo Unified. CUSD Insider is a great resource. You can see already information on there about principals who have recorded videos for social media. They're reaching out to their students, and a lot of work being done here, obviously, to prepare for distance learning to begin next week. In the meantime, while schools are closed, that doesn't mean, all that means really is that students won't be at the school site. The district is not closed, and so I do want to make sure that if families have questions, we will be there to answer them. We do expect that we will have staff in place to answer phone calls. We will be working in communications through email and all of the other things we need to do in order to make sure our families know what is going on. If you are not receiving email from the school district, please email us at communications@capousd.org, and we will help you figure that out. We have been sending a lot of information, so we want to keep you informed. And the best place, if you need, is just to go to our website, to the COVID-19 page, and that will give you all of the information up to date about what the district is doing. At this time, I just want to say thank you to Dr. El-Hasan As I had mentioned, he's a great supporter of the school district, and he works with a lot of families in San Juan Capistrano. We greatly appreciate his time and for being here with us today and answering these questions. And he will continue to be a great resource for all of us. Anything you want to say, Doctor, as we close?
I just wish everyone on this phone call the best, and we will get through this, and we'll come out shining. I have no doubt.
Thank you, Doctor, and thank you all for being here. This is being recorded, so we will take the recording, we will post it on the website, and we'll send the link out to everyone so that the information is available. And again, we just appreciate you being here with us today. Thank you all very much.
Thank you. Okay, thank you very much.
Thank you, Doctor.
All right, enjoy the rest of your day. Take care.
You too. Thanks. Bye.